Dr. Evelyn from Petsadena Animal Hospital. I'm here today with Lily from my dog spot, who's here to answer some questions that we commonly get as veterinarians about dog behavior.
I'm Lily from my dog spot. I do behavior consulting and some basic training, and I'm here to chat with Dr. Evelyn about behavior issues. On the subject of anxious dogs and dogs that have missed their socialization period and become anxious and stressed, a lot of my clients ask about medicating their dogs and if medication is an option down the line when we are seeing adult dogs that are incredibly anxious and stressed. What kind of medications are available? What are the side effects of these medications? Do these medications actually have an effect? Are they successful? Is it something that's viable for animals that are really anxious?
So that's a great question. I actually get that question a lot too. Sometimes people come to me because their dog trainer, behaviorist has recommended medication, looking into it, or thinks that it could be helpful in their training. Yes, there are different types of medication that we use when it comes to behavior problems. So anything from anxiety to aggression to fear, just kind of a combination of those. The types of medications that we use, if we're talking about a true medication, they're usually going to be antidepressants that are used actually in people as well. They're used at different doses, of course, and I tend to resort to using them when we have a situation where maybe the person's been working with a trainer, with a behavior consultant, and they're still having some difficulties, in particular with stress and anxiety. Those medications can reduce those signs and allow them to be able to participate in these behavior modification techniques. And actually, for the most part, we use them in conjunction. So I would never recommend them by themselves because they aren't going to change your dog. They're not going to make your dog. They're not. Yeah. It's always recommended to use them with behavior modification techniques because that's how you will be most successful, and that's how sometimes you can actually wean them down or off the medication eventually. Some dogs may need to be on it long term because that is, there's the biochemistry in their brain needs that type of medication to help them. But others just need it to get over the period of anxiety and stress that sometimes is provoked when we're trying to do certain techniques so that they can learn and then we can eventually take them off. They definitely do have side effects, just like they do in people. The side effects that are most common are going to be, being lethargic, being depressed, maybe reduced appetite. Sometimes they can have gastrointestinal signs like vomiting or diarrhea. Not common instances can they cause more anxiety. Rarely do they cause aggression, though. And there actually have been studies that have started to look at using it for aggressive pets in particular to help their aggressive behavior, and some of those have shown some promise. Again, you can't use it just as a single approach. It's a multimodal approach when we're talking about behavior medical problems. They should not cause aggression, but you always want to have them being used under the supervision of veterinarians so that if you do have some of these side effects, especially some of these unusual ones where they get more restless, more anxious, or aggressive, that you can have that discussion. Sometimes it's about taking them off the medication and trying a different one. Sometimes it's about adjusting the dose. And so you want to be able to have that conversation with your veterinary professional. And there are veterinary behaviorists who are board certified and trained with additional training for some of these cases that are very severe where maybe the medications, they react differently and your general doctor and your trainer behavior consultant is having difficulty managing the case. These are the doggies that would benefit from going to a veterinary behaviorist who has extra training and also works with these medications much more closely, has some other alternative options available.
Aggressive behavior is 90% behavior driven, and it is a result of stress and fear and behavior that is a result of the environmental consequences.
That's very true. There are supplements out there. There's other ways that we discuss, and you probably utilize some of these approaches as well, whether it's supplements that are calming, pheromones or scented hormones that are calming, that we utilize in conjunction with some of the techniques you probably use, or before I even try medication that sometimes can be helpful for some patients. Those can also be used in these kind of instances so that we can minimize or reduce having to use medications if possible.